Susan and Kim stood at the edge of the minor procedures room, reviewing the list for the afternoon. Kim scanned the notes and paused. AV fistula creation, she read aloud. I know it's for dialysis, but I'm not fully confident explaining it to a patient. Susan smiled. That's a good place to start, Kim. If you can explain it simply, you truly understand it. She pulled up a chair and gestured for Kim to sit. A fistula, in this context, is a surgically created connection between an artery and a vein, Susan began. We usually create it in the arm for patients who need long-term hemodialysis. Kim nodded. So it's different from a wound or abnormal fistula? Exactly, Susan said. That's an important distinction. In theater, when we say fistula, we usually mean an arteriovenous, AV, fistula, planned, controlled, and purposeful. She continued, there are a few types. The most common is the radiocephalic fistula, created at the wrist. Then there's the brachiocephalic fistula, higher up near the elbow. If the patient's veins aren't suitable, a brachiobasilic fistula might be created, sometimes in 2 stages. Kim leaned forward. And these are vascular procedures because? Because we're operating directly on blood vessels, Susan replied, arteries and veins. That means we're managing blood flow, vessel integrity, and bleeding risk. Vascular surgery requires precision. Even small errors can have big consequences. Susan lowered her voice as a patient was wheeled past. Another key thing to remember is that these procedures are usually done under local anesthetic. The patient is awake. Kim's eyes widened slightly. So communication is critical. Exactly, Susan said. That's one of the dose of vascular procedures. You reassure the patient, explain what's happening, and monitor them closely. You'll hear the surgeon talking about flow, thrill, and brute. Those are signs the fistula is working. She smiled again. And one big don't. Never take blood pressure, bloods, or cannulas from a fistula arm. That access is precious. Kim took a breath, feeling more confident. So an AV fistula is a planned vascular connection for dialysis. Different types depend on anatomy, and it's done under local because patient safety and cooperation matter. Susan nodded approvingly. Perfect. That's exactly how you explain it, to patients and to yourself.